Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over a 5-minute mind map of pressure ulcers or bed sores. So let's get started. So pressure ulcers or bed sores are wounds that occur from prolonged pressure on the skin. So people who are immobile or are in wheelchairs for long periods of time, they're most at risk. These painful wounds can grow extremely large and become infected if left unnoticed. So pressure injuries, they can be put into 4 categories. So stage 1, the skin looks pink. If you put pressure on it, it doesn't turn white, so it's non-blanchable, but there is no open skin. Now a stage 2 is a shallow wound with a pink to red wound base. A stage 3 is a noticeable wound that may go down to the fatty layer. And stage 4, it penetrates all layers of the skin with exposed muscle, tendon, or bone. Now I'll insert a picture right here so you can see the different stages 1 through 4. Now there is also an unstageable. This is where there is either necrotic tissue, slough, etc. in the wound where you can't see how deep it actually goes. Now, who is at highest risk? Obviously, age does play a factor. As we age, the people tend to sit for longer periods of time or lay in bed longer, so they are at higher risk. People with limited mobility, those who are using wheelchairs, those who are bedbound, or in casts and splints. Now, prevention. I always love to talk about prevention because we want to prevent rather than cure, because we always have to go back to the preventative measures to cure an injury, a pressure injury, to begin with. So we might as well just prevent it in the first place. So how do we prevent pressure injuries? We need to move positions frequently. So if the person is seated, they should be shifting positions every 15 minutes. If they're in bed, it's every 2 hours. We want to have regular skin checks. We want to stay hydrated and eat nutrient-dense food, keep our skin clean and dry. And we can also use air mattresses or air cushions, and those will help distribute the pressure. Now, what health conditions put you at higher risk of having a pressure injury? If you have cancer, cerebral palsy, dementia, diabetes, heart failure, kidney failure, or malnutrition, they can all play a role in putting you at risk for pressure injuries or bed sores. Now, treatment of a bed sore. Once again, we have to go back to the preventative measures, making sure that person is turning every 2 hours if they're bedbound, or shifting positions in a chair every 15 minutes. So we need to do that, but then we're going to clean a wound, apply an appropriate cover dressing for moisture balanced wound. Okay, moisture balance is best practice wound care because it allows a wound to heal the quickest. So I hope this video did give you a good idea of the different types of pressure ulcers, how to prevent them and how to treat them, and why prevention is so very important. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.